Президент Российской Федерации.
President of the Russian Federation, Vladimir Putin. Thank you so much. Good afternoon. Distinguished friends, colleagues, allow me to welcome you all to the Congress that has been gathering for a third year in a row. It is a flagship platform for a comprehensive discussion on prospects of national health care. I'd like to mention right at the outset that many recommendations elaborated at your forum have already gained high professional recognition. They are being followed up by federal and regional authorities and are being widely implemented in medical institutions. And the exchange of experience with foreign participants of the Congress is mutually enriching the respective national healthcare systems. Russia is making constant progress in this field. Starting from 2019 and to 2025, for implementation of sectoral federal projects, we have allocated about 1.7 trillion rubles. This significant financial assistance helps addressing not only day-to-day tasks, but also reaching breakthrough results. Let me remind you, we were the first in the world to register a COVID vaccine. It helped preserve health and lives of millions of people in 71 countries of the world. The share of domestic drugs and medical equipment is growing in our country. We are strengthening the technological sovereignty of our healthcare system. We are intending to go down this path in the future and enhance resilience and independence of the Russian healthcare system. Undoubtedly, it is one of the national security issues. Colleagues, you are well aware that starting from 2025, Russia will start implementation of new national projects. They include those entitled Longevity and Active Life and New Health-Preserving Technologies. Strengthening and development of healthcare are undoubtedly in the focus of these national projects and encompass almost all of its fields, from local hospitals to implementation of advanced technologies and raising the health culture. These national projects are characterized by a comprehensive and broad approach to the use of all factors and resources impacting the preservation of population, and it is task number one in our country. Let me stress that all our national projects are centered on an individual, on putting in place conditions for enhancing the welfare and quality of life of our citizens. One of the main goals for the upcoming years is increasing the life expectancy, and I'll stress the need to reduce the gap in indicators among the regions of our country. It is well known that there is a difference in the life expectancy between men and women. It is lower with the men. We should address these issues and problems in a consistent manner. On the whole, the life expectancy should reach 78 years, and in the future, just as we have planned before, we should reach the 80+ level. In this context, I would like to highlight the key tasks of our new national projects that I've just mentioned. First, the life expectancy should be growing at an advanced pace in those regions and those groups of people, something I've just mentioned, where it is lagging behind the country's average. As I've mentioned, we should reduce the gap. Second, people in Russia should become much healthier and suffer less and more seldom from diseases, including, I'll stress it, thanks to healthy lifestyle, good nutrition, and timely preventive measures, and the effective work of preventive medicine on the whole. And third, something that is particularly crucial, it is active and dignified life that should become longer, when, regardless his or her age, the person has the possibility and primarily the wish to continue working, staying if there is a possibility to do so, preserve the leading role in the profession, dedicate time for family and grandchildren, travels and participation in social and public initiatives. We agreed that family should be an overarching theme of all our national projects. I ask the government, when they will be fine-tuning the projects, to take it into consideration. We will definitely address this issue at our upcoming meeting of the Council on Strategic Development and National Projects. In the course of implementation of these projects, strengthening the health of our people should be at the cornerstone of our future work. In the Family National Project, there are lots of provisions and guidelines closely interrelated with the development of our healthcare system, because a healthy nation means healthy family in any generation. Over the past years, we've done a lot for maternal and child health preservation. We have established a modern system of perinatal centers, including 175 facilities all across the country. We have developed an efficient patient routing system. Today, we record the lowest infant mortality in history, 4 cases to 1,000. Under the new national projects, we will create more than 360 women's healthcare clinics, and perinatal centers will be equipped. I would like to draw the attention of regional leaders that they should pay particular attention to this. I have seen some centers that don't look particularly up-to-date, and I've seen those that are considered to be new and modernized. Well, it looks like we are making progress, but we should take particular care of each and every step. We should equip our centers and ensure comfortable working conditions for doctors. Of course, the foundation for strong health is built in the childhood, and then throughout life, one should take care of prevention measures, physical culture, and sports. These issues have always been in the focus of the outstanding doctor and scientist Nikolai Semashko. Today's plenary session of the Congress, as far as I understand, is dedicated to his 150th anniversary. Academician Semashko has practically revived the domestic healthcare system, and most importantly, revived it with new approaches. More than that, his breakthrough initiatives and ideas have guided the entire world. We will continue strengthening and developing our healthcare system, renewing its infrastructure. For the upcoming 6 years alone, renovation and re-equipment of medical centers, we have allocated over 1 trillion rubles. Particular focus will be made on enhancing the primary healthcare. This part of medical healthcare service is particularly important. It registers a total of 1 billion visits per year. Primary healthcare facilities have already been modernized in every third medical institution in our country. Over 140,000 units of medical equipment have been purchased for rural medical posts, clinics, regional and municipal hospitals. Healthcare has become more accessible and comfortable for millions of people. Let me reiterate, the work on this track should be continued. It is one of key demands of our citizens. We will take efforts to fight such severest diseases as cancer and cardiovascular diseases, diabetes and hepatitis C. The respective national project contains a lot of specific guidelines for implementation of innovative treatment methods, including with the use of artificial intelligence. We have lots of ideas in this field. In Moscow, for instance, we are testing a future-oriented digital platform that, with the help of artificial intelligence, large data volumes on medical examinations are being processed, which assists doctors with their diagnosis. I have visited one of such platforms, and it is something obvious that artificial intelligence is very helpful, but it only assists, and the main role is played by the doctor. I'm not going to go into details, but it has become obvious during my talks and conversations and my examination of the technologies. Such an integrated digital platform needs to be developed that will help a citizen preserve and maintain health throughout life, and we should do it all across our country. In future, this principle of AI-assisted analysis of the health status of a person and all accessible examinations should be at the heart of the entire health management and preservation system. Another obvious priority is support of medical science and technologies, including longevity studies. For the first time, we will see the emergence of a new and highly relevant field, namely expansion of the infrastructure of nuclear medicine that opens up prospects of more precise diagnostics. We already have lots of scientific and research centers conducting research in this field. We will contribute to broad implementation of these achievements. Another important topic is disease prevention. It encompasses a wide range of issues that can only be reached with the active involvement of people themselves. Therefore, we should be insistent and consistent in encouraging our citizens to do sports, take care of their health, and necessarily take regular medical examinations. We should undoubtedly encourage those people who regularly do sports and take care of their health. Therefore, in particular, we decided, starting from the next year, to impose tax returns for those who make regular medical checkups and successfully pass the Ready for Labor and Defense tests. But here, too, we should be very careful. You know what? We need to make sure that such tests cannot be bought for money. We should fine-tune the system. A key topic is salaries of medical personnel. I mentioned it in my address to the Federal Assembly. You know that salaries of medical personnel are linked to an average salary in the regions, but it is obvious at the same time that this level is different, and quite often it differs even in the neighboring regions of our country. Of course, we have been discussing it with my colleagues in the government for a long time already. This gap in salaries of medical personnel, teachers, and other specialists should be eliminated. It is obvious. 2025, we will test a new just payment model for state employees in a number of pilot regions of our country, and in early 2027, we plan, I hope it will be successful, to spread this system to all state employees in all regions of the country of the Russian Federation. Obviously, this will include the healthcare system. Distinguished colleagues, your Congress is undoubtedly a landmark event for our country, for our citizens. Therefore, I would like to sincerely wish you fruitful work, success in your noble and self-sacrificing service. And of course, I hope that, just as all citizens of the Russian Federation, you will take care of your own health. Stay healthy and happy. Thank you so much for your attention.